Erection and orgasm are pretty similar in men and women in terms of erectile tissue is dilating. You can read through this. You can pause and read through this. And we won't be focusing on the hormonal controls of the female either. Although the hormones from the hypothalamus and the pituitary are the same as for the males, FSH and LH. FSH causes the follicle to mature. FSH stands for follicle stimulating hormone. And LH, there's a surge of LH that causes ovulation. You can pause and read through this, but a lot of detail. So here's a chart that's very, very interesting. It shows the hormonal concentrations of the brain hormones of the, the female hormones, and this is showing the changes that are occurring in the ovary, and this graph down at the bottom is showing the changes that are occurring in the thickness of the endometrium. And these are changes that occur on a regular basis over a 28-day menstrual cycle. So that the menstrual cycle, this day starts at day 1 of menstruation is the beginning of the cycle. And so you can see the thickness of the endometrium is being sloughed off. And over the course of the next, 10 days, there is an increase in estrogen and progesterone. And at day 14, there's an increase in the thickness of the endometrium as it prepares for the embryo. You can see in the ovary that the follicle is maturing. And then just at day 14, there's a surge of LH, and that it's the LH that causes that final maturation of the follicle and ovulation. And then you can see what's happening to the hormones after that, and so on. So if you looked at the side effects of, say, birth control pill, which contains estrogens and progesterone, you would see a lot of side effects like mood swings and water gain, that sort of thing. You can imagine that just naturally, all of these changes are taking place all the time in a woman's body. These hormones do affect the brain, and they do change how a woman feels. So ask yourself these questions, see if you understand that graph a little bit. You certainly don't have to memorize that graph, just try to understand what it's representing. Down here is the body temperature. And so right at ovulation, you're going to see, a woman's going to see an increase in her body temperature, a very slight amount. But if you're taking your temperature every single day, you will notice that change. What's the function of LH in women? Promotes estrogen production and ovulation. Menopause usually occurs in late 40s or the early 50s. If you want to know how your menopause is going to be, talk to your mom. The reproductive cycles stop. The ovaries don't produce the estrogen and progesterone anymore. Some female secondary sex characteristics may disappear. There may be some facial hair, hot flashes, migraines, all kinds of issues, or no issues whatsoever. Some women have absolutely no problem going through menopause. The mammary glands are designed to secrete milk. As puberty is reached, ovarian hormones will stimulate development of the glands in females. And you could, oops, what happened there? Okay. Whoop. So you can see here that the glands are kind of lobular glands here, and then they are going to, the milk will then flow through these ducts and then through the nipple. Some women have cysts in their breast tissue. It kind of changes what your breast would look like with a mammogram, but it's very normal, and that's why mammograms are kind of important, because you can see if there's any changes from, your baseline, should you have that fibrocystic breast disease, which is not dangerous. It's just that the breast tissue changes somewhat for some women as they get older. Now, breast cancer, pardon me, is malignant metastasizing tumor. Leading cause of death of women in certain ages. Risk factors include history of breast cancer. First pregnancy is a little bit older. Early menarche is your first menstrual period, or late menopause. But there are lots of treatments for breast cancer. These are available. And this is a mammogram showing breast cancer. Ovarian cancer is also pretty bad. It's difficult to diagnose early. Sometimes women have abdominal symptoms, like they think it's their gastrointestinal tract that's causing problems when it's ovarian cancer. It's just tough to get it early. So when you go in for your pap smear, you'll notice here that this cancerous ovary is much larger. Well, when you go in for your pap smear, your doctor can actually palpate your ovaries. So you might ask your doctor, can you feel my ovaries? Do they feel healthy? And you can get an answer. Birth control, HPV, cervical cancer, for the HPV vaccine, because boys and girls can get it. It is a preventative event. 75% of cervical cancer. And if your doctor were doing a pap smear, looking at your cervix, that is what so they take a small sample of cells, test it. Different kind of control, coitus interruptus. Spermicide is pretty useful if there's a mechanical barrier and a spermicide. The rhythm is, I don't think that works very well, because all the Catholics I knew growing up had lots of kids. But it is a method. Some mechanical barriers, a diaphragm. There are female condoms now. There's all kinds of stuff. There's an IUD. The purpose of an IUD is it sets up a mild infection in your uterus. Not really an infection, I'm sorry, an inflammation. And so the egg will be fertilized by the sperm, but the definition of pregnancy is when that zygote embeds in the endometrium. And if you've got inflammation in the endometrium, there will be no embedding of the embryo. So the fertilized egg will just pass out of the body. Most people these days are probably using patches, pills, shots. There's so many different methods. Each method effects are as terrible as blood clots in your lungs. Surgical method for a woman is much more invasive than for a man. For a man, they just have to cut through the scrotum, which is just fine skin, and then cut the vas deferens and seal it. But a woman is in that dominant surgery. Not how crazy. So be aware of all the symptoms of STDs and look before you leap. And here are some fun infections.